Hello, teacher. My name is Diana Stephanie Mejia Manza. I belong to Session 3, and in this time, I will be introducing Chapter 1 to 4 of Professional English in Use. So let's begin. Page 10. Hair and earnest. Asking about hair. Hair is the state of the body. When doctors want to know about a patient's usual hair, they ask questions such as, what is your general hair like? How is your hair generally? If you are in good health, you are well and have no earnest disease. If you are healthy, you are normally well and you can resist illness. If you are fit, you are well and strong. Not well. When you are not well, the opposite is healthy. Fit, fit and well, well, very well, in good health. When you hear synonymous is unhealthy, unfit, unwell, not well, not very well, poorly, in poor health. Part B. Sickness. Sickness have a similar meaning to illness. It is also used in the names of a few specific diseases. For example, sleeping sickness and travel sickness. Patients also talk about sickness when they mean nausea and vomiting. Patient says, I was sick this morning. Possible meanings. I was ill this morning. I feel unwell this morning. I vomited this morning. I feel sick. Possible meaning. I feel ill. I feel unwell. I am nauseous. I feel the need to vomit. The combination sickness and diarrhea means vomiting and diarrhea. Section C. Recovery. When patients return to normal health after illness, they have recovered. We can also say the patient made a good full complete recovery. If a patient's health is in the process of returning to normal, the patient is improving. The opposite is deteriorating. We can also say that the patient condition improve or deteriorate. In speech, we often use the verb get to talk about change. Get over an illness. Better. Get worse. Get over our illness equal to recover. Get better equal to improve. Get worse equal to deteriorate. If a patient is better but then gets worse again, the patient has realized another word for improvement, especially in recurring conditions such as cancer, is remission. He got over the illness very quickly. 2 years later, they remain in complete remission. Page 11. 1.1. Complete the table with words from A and B opposite. The first one has been done for you. Noun, adjective. Thickness, fit. Health, healthy. Illness, ill. Sickness, sick. 1.2. Make word combination using a word from each box. Look at B and C opposite to help you. Complete remission. Feel sick. Get over. Poor health. traverse thickness. 1.3. Complete the conversation. Look at B opposite to help you. Doctor and patient. How are you feeling today? Not very well. How long have you been feeling unwell? About a week. What is your health like normally? Very good. I am usually quiet, fit, and well. What is the problem now? It's my stomach. Do you feel sick? Yes. Have you actually been sick? No. Have you had any serious illness in the past? No, not at all. Point 1.4. Choose the correct word to complete each sentence. Look at B and C opposite to help you. Her condition deteriorated and she died. He recovered and was allowed to go home from the hospital. The cause of sleeping sickness was discovered in 1901. The patient made full recovery. I have been in good health for months and feel very fit. It was a month before I got over the illness. He seems to be rather unhealthy. His diet is bad and he never exercised. Page 1, part of the body 1. Part of the body. Most external parts of the body have ordinary English names as well as anatomical names. Doctors normally use the English name even when talking to each other. There are a few exceptions where doctors use the anatomical names. These are shown in brackets below. Jaw, mandible, neck, shoulder, armpit, axilla, upper arm, elbow, back, buttock, breast, thigh, calf, leg, chest, thorax, ribs, stomach, tummy or abdomen, navel, umbilical, hip, groin, inguinal region, neck, knee, patella or kneecap, chin. Limb means arm, upper arm or leg, lower leg. The trunk is the body including the head and limbs. Part B, referring to part of the body. When patients speak about their problem, they often refer to a part of the body. For example, I'm having trouble with my hip, I'm having trouble with my shoulder, I'm having trouble with my knee. The doctor often needs to ask about a part of the body. For example, do you get any pain in your chest? Do you get any pain in your stomach? Do you get any pain in your back? Part C. Describing radiation of pain. A patient is telling the doctor about his back pain and the part of the body is radiated to. It starts in the back, then it seems to go into the right buttock and down the back of the right thigh to the knee. Page 13, 2.1. Write the ordinary English word for the corresponding anatomical term in the table using your medical knowledge. Look at A opposite to help you. Anatomical term, common word. Abdomen, stomach. Axilla, armpit. Carpus, breast. Coxa, hip. Cubitus, elbow. Mama, breast. Nape, buttock. Patella, kneecap. 2.2. Complete sentences using ordinary English. Look at A and C opposite to help you. A male patient describing inguinal pectoris. Is It is like a tiny across my chest, and it goes into my neck and into my left shoulder and down the left arm. B. A male patient described with renal colic. It starts in the loin and goes into the groin and down into the testicle. 2.3. Complete sentences look at age opposite to help you. Anatomical term and present statement. 1. Inguinal swelling. I got along into the groin. Abdominal pain. My little boy got a stomach ache. Periumbilical rash. I got some spot around my navel. Thoracic pain. I got a pain in the middle of the chest. Oligoaxillary node. There is a painful swelling in my armpit. Mandibular pain. I got a pain in my jaw. 2.4. Complete the table with words from the bus. The first one has been done for you. We had some words as abdomen, knee, elbow, chest, loin, arm, wrist, leg, thigh, finger. Trunk. Abdomen, chest, loin. Upper limb. Elbow, arm, wrist, finger. Lower limb. Knee, leg, and thigh. Page 14. Part of the body 2. The abdomen. The main organ for the body has ordinary English names, and doctors use this word, but when an adjective is needed, they often use anatomical words. For example, we can say disease of the liver or hepatic disease. Some abdominal organs, for example, the pancreas, have no ordinary name. Pancreas, duodenum, gallbladder, liver, right kidney, stomach, spleen, left kidney. When doctors talk about the main part of the digestive system, they use the word bowel or intestine. The small intestine or the small bowel, the large intestine or the large bowel. When speaking to patients, doctors may refer to the anus and rectum as the back passage. The chest. The chest, thorax, contains the organ of respiration and the heart. The main part of the respiratory system are the airways and the lungs. The left lung is divided into two lobes and the right into three. The airways consist of the larynx, the trachea or windpipe, the right and left bronchus, and the bronchioles. The chest is separated from the abdomen by the diaphragm. The pelvis. A doctor is explaining the function of the bladder to a patient. The bladder is situated in the pelvis, as you know, and it is connected to each kidney by a long tube called ureter, one on each side. The ureter carries the urine from the kidney to the bladder, where it is stored until you decide to empty your bladder. When that happens, the urine passes down another tube called the urethra to the outside. Page 15, 3.1. Label the diagram using words from the bus. Look at B opposite to help you. 1. Windpipe. 2. Lung. 3. Lobe. 4. Diaphragm. 5. Airways. 6. Heart. 7. Bronchioles. 3.2. Marks the condition 1 to 8 which the organ affects 8 to 8 using the medical novel. Hepatitis, liver, pneumonia, lung, nephritis, kidney, gastritis ulcer, stomach, cystitis, bladder, inguinal pectoris, heart, cholecystitis, gallbladder, ulcerative colic, large bowel. 3.3. Complete the textbook strand. Look at A and C opposite to help you. Examination of the abdomen. To examine the patient for enlarged abdominal organ, first the liver and the gallbladder on the right side. To do this, ask a patient to take a deep breath while pressing with the finger outward and inward. Next, feel the right kidney and then cross over to the other side for the left kidney. Still on the left side, palpate for an enlarged spleen. Finally, moving to the lower abdomen, feel for the bladder, which is only filled if it is full. Page 16, Part A. Eating. You are hungry and you are in a restaurant and the waiter brings you food. You smell it and it stimulates your appetite. You want to eat, your mouth waters, filling with saliva. You take a bite of the food, it tastes good, and you chew and swallow it. You eat more, but then suddenly you taste something unpleasant. You feel nauseous. You rush to the toilet and you get there just in time before vomiting all the food you had eaten. Something had disagreed with you. Part B. The five senses. In addition to smell and taste, these senses include sight of vision, hearing, and touch, also called sensational feeling. To ask about the sense, doctor use the questions: what is your sight like? What is your hearing like? What is your sense of smell like? What is your sense of taste like? Is your sight normal? Is your hearing normal? Is your sense of smell normal? Is your sense of taste normal? To ask about the sense of touch, doctors talk about numbness, love of sensation. Have you noticed any numbers in your finger or toes? Part C. Other fusion. Fusion. Bear, no. Speaking. Bear, speak. None, speech. Fusion. Working. Bear, walk. No, gain. Function. Breathing, respiration. Bear is in out. Breathe in, take a breath in it's out, breathe out. No, breath. Urination, mituration. Bear, urinate, miturirate. Pass urine, pass water. No, urine. Defecation. Bear, defecate. Pass faces, pass stalls. No, faces, stall. Function. Menstruation. Bear, menstruate, have a period. Noon. Menstrual period. Monthly period. When talking is history, doctor can ask, do you have any trouble walking? Do you have any difficulty breathing? Do you have any problem passing urine? Do you have any problem with your speech? Do you have any pain when you breathe in? When auscultating a patient's lungs, the doctor tells the patient, take a deep breath in, hold your breath, then breathe out completely. Part D. Less common friction. There are some things we do less often. When we are hot, we sweat. When we are nervous, we shake. When we are sad, we cry. Doctor can ask, do you sweat more than usual? Do you shake more than usual? Page 17, 4.1. Match the symptoms 1 to 5 to the question A to E using your medical knowledge. 1. Dysuria. Do you have any pain when you pass water? 2. Dysphagia. Do you have any trouble swallowing? 3. Diplopia. Is your vision normal? 4. Dysphagia. Do you have any difficulty with your speech? 5. Dysphonia. What is your breathing like? 4.2. Patients are describing symptoms of the condition shown in brackets. Complete the sentences. Look at C and D opposite to help you. I got a pain. I had got a pain and numbness in both feet. I am having difficulties swallowing solid food. I have a lot of problem passing urine. I have been swallowing more than using even when it's not hot. I have noticed that my hands shake when I am not using them. I had trouble breathing when I clean the stairs. 4.3. Complete sentences. Look at A, B, C, and D opposite to help you. When I eat solid food, I have to shade it for a long time before I can swallow it. Do you have any pain when you pass toast? I have no appetite and I have lost 5 kilos in the last few weeks. When do you have a period? The garden is full of flowers, but my sense of smell had disappeared and I can't enjoy the perfume. Take a deep breath in.